Okay, today we are in AIE Fall 2014 Boot Camp. If you could hold that up so we can get a better shot of that. This is Dr. Conderato, and we're about to ask a few questions about the course. Here, I'll take that.
Okay.
Okay, what is your, oh, sorry, I'm going to start over. What is your experience with dental implants?
Minimal experience with dental implants. I've taken a lot of classes. Last year I took a surgical class, which we did work on live patients, and the class was great. Placed a couple of implants, but that's it. Placed a couple of implants. That was my background. I feel it was pretty great. But I needed more experience. Tried to do them in private practice. I was with a corporate company and just wasn't able to make it happen with the patient base. So I'm starting a new practice and I want to offer implants, and I thought I need to expand my surgical skills, and that's why I'm here.
How are dental implants beneficial to the patient?
Oh my gosh, I've been practicing for 27 years and I have seen the failures. I've seen the life cycle of the tooth, the large filling, the crown, the root canal, the failed root canal, and the eventual extraction, and then how are we going to fill this space? And in the past, everybody was comfortable and trained with putting in a 3-unit bridge. As the results started coming back in, 3-unit bridges versus implants, implants were shown to be a much longer lasting restoration without that fear of the recurrent decay, patient hygiene issues, so on and so forth. So today, when I recommend to patients how they should replace a missing tooth, the implant is the first restorative option I give them. And in some cases I won't give them another I'll tell them about the options, but I won't cut down non-restored teeth for a fixed bridge. I just won't do that. And the more I get into the implants, the more I see the value of it.
That's fine. Keep on going. They can edit it. Okay, I got it.
All right.
That's fine. Don't worry about it. Yeah, that'd be great.
You're
Thank
okay.
you. Why is it important to operate in the U.S.?
Well, for me, funny story, my passport's expired, and I'm going to be starting in my practice in December, and I was in a bit of a time crunch, so I wanted to kind of get this in before I started my practice, because I know I will be placing implants in that practice. So it was important to be able to stay in the U.S., not have passport issues, but it was also important. I maybe would feel uncomfortable practicing on these in the foreign country. I don't know if those patients are followed up afterwards. I don't know. It just made me a little uncomfortable, just to say the least.
Why is it important to operate on the live patient?
Oh my gosh. Well, you get all the things that go in with working with a live patient. You get the saliva, the tongue, the nervous patient, the patient that's uncooperative, the tissue, everything that we're familiar with, but dealing with implants, tissue tearing, patient not getting numb, patient's blood pressure not coming down enough to do the surgery. It's important to do it on live patients so that we can experience the real world, not only the things that trip us up, but seeing what something successful looks like. I just did an implant. It looked like it was the perfect amount of bone. When you looked at it on view, perfect amount of tissue. When I opened that up and flapped it open, there was a little defect there, and was able to put the implant in and also fill in the defect. And I know that patient had a great service. I know she did. So it's important to be able to feel the bone, feel the drilling, feel putting those instruments in. All of that. It's important.
How beneficial I'm sorry, I'm going to restate that. I stumbled over that. How is it beneficial to learn on live patient under the guidance of experts like Dr. McCracken and Guy Rosensteel?
Well, I don't know how many times I went and got those guys to look at each and every patient I had, from beginning and middle to end. Their expertise was invaluable because they've pretty much seen everything. Although yesterday we had a situation that maybe they didn't see. We had a little driver that was caught in the implant, and it took us a little while to get that out, and everybody kept saying, "Oh, this never happened before," and I'm thinking, of course it happened to me, but it was a great learning experience for everybody that was around, and the problem was solved, patient was fine, but these guys, they know their stuff. This is a place that does more implants than any place I can think of. So you're seeing everything, you know, the good, the bad, and the ugly, but these guys are available to you know, show you how to work the software, help with the patients. I mean, it's invaluable, but you can't beat it.
What benefits do you foresee by having taken the AIE boot camp?
Oh my gosh. Well, it was condensed. You know, we did the didactic learning in the beginning, and then we went right ahead and were able to place the implants, you know, day 2, day 3. That information was still fresh in my head, and to be able to apply that knowledge hands-on immediately, to me, was invaluable, because, you know, you go home and you don't see an implant patient maybe for a while, and you start to lose all of that stuff that you were taught. To be able to apply it on those days several times, I feel like it's kind of locked in my brain. I feel like I've got a really great foundation. I know what I'm going to choose to do, but I also know what I'm going to choose to refer.
Did you place any dental implants beforehand? A few?
I did. I placed a few, maybe 2 or 3, and that was a good experience. One was in that classroom, you know, in that class that I took, and another was in private practice, and you know, everything went well.
Can you tell us about the clinic and the staff?
Oh my gosh, I've made sure I talk to everybody that works here, just to kind of get to know them and see what their feel is. And everybody seems to be very passionate and very caring and dedicated and talented with what they're doing, and it's a great staff. Everybody was incredibly helpful. I probably interacted with everyone, which was great. They make it easy, everything's well equipped, everything's clean, but the people have the compassion for these folks, and that's what I like to see, was the compassion.
Is there anything you'd like to add, just experience-wise, that we haven't covered?
No, I mean, yes, of course I wish there was more, but we have we have only so much time to learn, and I mean, this could be, you know, how long, 4 years if you want to do specialty, but for the foundational basis, yes, I think, you know, of course I want to place more implants, but, you know, we have to go with what we have coming into the clinic, and I'm hoping I can place another implant or 2 this afternoon.
You will. You're on schedule
I
too.
hope so.
So
Okay.
It looks like it.
Yeah.
They just haven't assigned yet.
Okay.
Well, thank you.
Thank you.
That's it.